Namaskar, I am Dr. Pratik Mitra, Consultant Critical Care at Narayana Superspeciality Hospital. On today's session, I want to talk on dengue fever. It's a presenting problem in our society and elsewhere. Common symptoms are fever. Dengue is a virus fever and it is usually transmitted by mosquito named Aedes. And there are different types of Aedes mosquito, Aedes aegypti and Aedes albopictus. It's a viral fever, and whenever that dengue virus content mosquito bites some person and the same person develop dengue fever within 10 to 14 days. And there are 4 types of dengue virus, 1, 2, 3, 4. And sometimes any patient can get infected by either a single virus or multiple virus. Single virus causes mild symptoms, but multiple virus always complicated with severe symptoms. Like dengue fever have different types of symptoms. A patient can be asymptomatic. A patient have very mild symptoms of body pain, fever, joint pain, rashes. Some patients have thrombocytopenia, low platelet count, and also there are life-threatening complications. Dengue hemorrhagic fever, where there is the severe life-threatening hemorrhage, and another is the dengue shock syndrome, where there is the capillary leak with the hypotension. It causes life-threatening for the patient. Now, what we can do for whenever we have any fever in this present time, whenever you have fever, you have to be cautious about the symptoms like fever, retroorbital pain, joint pain, loose motion, severe nausea, vomiting, severe weakness. Immediately you need to consult doctor, and initially you can take paracetamol, but if the fever state say for 1 to 2 days, then you have to consult a doctor. Depending on the symptoms, we have to give you some test. Common test we are giving for dengue fever is H1N1 Antigen test, Elisa, dengue IgG, IgM antibody. H1N1 Antigen is an initial test we usually done in initial 1 to 2 days, and later if the fever duration is more than 5 days, then we have to go for a dengue IgM antibody test. If IgM positive, it means you have acute dengue fever, and those who have positive dengue IgG antibody, it means that patient is a chronic dengue patient. It means earlier he got infected with dengue fever, and again if for that patient if both dengue IgG and IgM both are positive, it means there are chances of severe infection, there are chances of severe complications in this patient. So how we can manage the patient? We can manage the patient with saline, with proper hydration, with supportive medicines to avoid or to treat nausea and vomiting. Sometimes some patients have loose stool, we have to give them conservative treatment. Few patients develop deranged liver enzyme, we have to manage accordingly depending on the symptoms. Dengue is a self-limiting disease, but the time until the infection is there, we have to manage the patient symptomatically as per the symptoms. Problem of thrombocytopenia, low platelet, started usually after 5 to 6 days, and we have to monitor the platelet count regular basis, especially on the second week of dengue fever, at least twice a day. And if we find there is a low platelet count, then we have to monitor more strictly. But the critical value to give platelet transfusion is 20,000 with bleeding. If any bleeding, like there may be an internal bleeding, there may be an external bleeding, like from the nose, from the rectum, from the oral mouth or from the eye, around the eye. And if there is no bleeding but platelet count less than 10,000, we have to give platelet. There are different types of platelet. One is the single donor platelet and one is the random donor platelet. It's depending on the situation, we have to give platelet. But in our ICU setting, or sometimes some patient require some invasive procedure, it might be an emergency surgery or all, then we have to give platelet with a more higher value, say 50,000. In that case also we need to give platelet even if the count is 50,000. And now how you can prevent dengue? This is the most important thing, as because dengue fever can cause a severe life-threatening problem. It affects the person socially, mentally, financially, with the morbidity and mortality not only to the patient but to the family members, but to the society, but to the country. It causes a huge, increases the morbidity and mortality, and it ultimately it affects the financial situation of our country. So the most important prevention is that to avoid getting water logging in your household area and around the houses. You need to be very cautious just to avoid any water logging stay for 5 to 6 days or more. So you need to daily change the water whenever you can, like where you will able to avoid the water logging you can do, and where you have to keep some water like for flower vases, then please change the water daily basis. And second thing, to avoid get bitten by mosquito, you can use any repellents, you can use any coils, anything suitable to you, you can use it in at your own comfortable way. And sometimes we have water reservoirs or tank and the roof, so it is preferable to avoid any open area, and it is preferable to use curtain so that any mosquito is not able to enter into the water tank. In that way you will be safe, your family will be safe, your friend, relatives, your neighbors will be safe, and in that way you will do some, with this small step you can save many persons around you, and you can save the country also through many ways. Thank you so much.